Halloween and Thanksgiving will likely look differently this year because of the coronavirus pandemic, but there are ways families can have fun while staying safe. Touro family medicine physician Dr. Meredith Maxwell is here with some of those ideas. Good morning, Dr. Maxwell. You know, you and I were talking a moment ago about this study out of Japan yesterday that said that if you're around a dinner table, you are more likely to be infected by the person sitting next to you on one side or another than you are from the person 4 feet across the table, which I guess goes to proximity?
Yeah, so you might want to think about your layout. Really, I want to encourage people to really just have a Thanksgiving meal with those in their home. But if that's not possible, to really think about the layout of how you're seated, because it's true, proximity to another person and you're talking and you're eating, you think about those aerosolized sprays and contraction that way. So you really want to rethink, you know, the kids' table this year. Maybe not so many people crowded at the big table.
Or if grandma absolutely insists that she wants to come, that if you don't do it outside, that's the best thing. But
Right.
make her the head of the table and don't put somebody next to her.
Exactly. And still really try to think about, even if you tested negative, you might still be in that window. So it doesn't 100% protect anybody. So you really want to protect that person who's doing well, who has the risk factors, who's in that age range, and just think about what that means. I know we all want to be together, but at what risk?
Well, and I think that's the danger, because people hear this, you know, on TV every day, and it's sort of like yada, 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 you know, yeah, we get it. But from a practical standpoint, you are seeing cases of spread in these types of gatherings if they're not done correctly?
Exactly, because, you know, you have your pod, but maybe those people in your pod haven't been smart that weekend or that week, and you don't know that because you can't control what they're doing or follow what they're doing. So you've got to think about all the people that you come in contact with on a daily basis and then trust that they're doing the right thing. So it's a really kind of risky prospect to bring in those who have been doing well and have those high risk factors. Instead, maybe have a virtual dinner with those friends and families, and maybe shop online for the day after Thanksgiving or that next Monday, instead of going into the Black Friday and putting yourself or others at risk. So those kind of things can really make a big difference.
But I do think there are a lot of people who, you know, who are looking at this and saying, look, I haven't been around my mother much since February or since March. I'm going to have a Thanksgiving. So your message is that find ways to space it out and do the best you can?
Definitely, especially at the dinner table. You want to wash the hands, you want to wear the mask, maintain social distancing. You know, if you are going to take that risk, you know, you want to protect everyone in the family as much as possible. And we understand Thanksgiving is a time where sometimes you just can't, you know, avoid seeing those people or coming into contact, but still think about the precautions.
Gotcha. Meredith Maxwell, we appreciate it as always, Doc. Thank you so much.
You're welcome.